Hi, I'm Dr. Elizabeth Coyne, and I'm just going to present 7102 NRS Assessment Item 3. So again, just look and remind yourself about the course profile, the learning objectives for the course, and also the assessment policy. So assessment item 3 is the biggest one, 2,000 words, which is really actually not a lot of words, and worth 40%. So something to think about as you're walking through the modules. Prepare yourself for this one. Look at the coroner's cases, identify your coroner case that you want that links to your clinical area, and then start working through it. So we really want you to demonstrate critical evaluation of patient deterioration that ended in death. So this is what their coroner cases are about. So it's a fairly simple process. Introduction, discuss and justify, and then with the case study, evaluate it, and really look at that critical evaluation. This is not descriptive. This is you actually thinking, what happened? Why did it happen? What should have happened? What could be done about it? So we have given you a bit of a word count, which gives you an idea. Remember, you don't need to be exact on this, but you do need to be exact on the full word count. So you might find that you have 250 and then 550 instead of the sort of 300, 500. So just think about sort of how it flows for you. Introduce your topic. Remember, simple, it's 100 words, 2 or 3 sentences, but explain what you're going to do. Recognition and response to deterioration. Discuss and then critically go through this 200 words, making sure you're thinking about the marking criteria. Clearly and concisely evaluates the situational factors related to this patient. So we don't want factors which are sort of different. We want the situational awareness. So this is maybe staffing, outside factors, timing, resources. These are the situational awareness. Make sure you've read over the modules to understand what that means. And make sure you sort of choose a topic that aligns with your patient area. Then the case study evaluation. So looking at then 800 words. And so this is where most of the marks are. So research the condition and management, critically evaluate the case study and identify situational factors, identify patient-related factors with the complexities. Think about legal and ethical issues and how they requirements so that, was there the wrong staffing level, the wrong staffing mix? Was there inadequate resources for this patient? Was there not enough time management? Was it not the speed of the normal transition followed correctly? And then always with references. So not just everyday references, we will be looking to check that these references apply to this area. And the marking criteria, make sure you understand clearly and concisely evaluate situational factors for patient deterioration and a strong justification. Recommendations. So this is 30 marks. So again, fairly big area here. So make sure what you're looking as your situational and your critique aligns to allow you then good recommendations. So recommendation strategies for improvement related to your trigger points you identify. So explain how to look at that leadership aspect, align your recommendations with your standards. Remembering you don't need to write out the standard, but you might then sort of have standard 3.2 reference. And then in this standard, it recognises the need for quality administration of medications with correct patient understanding. This was not followed in this case study, and the patient was given sort of the incorrect medications. So this, make sure you've sort of followed it through. Support your recommendations with research to make sure it's not your words, but research underpins it. Again, marking criteria, recommendations are strong links to the standards, ethical and legal principles are linked in, and strong use of evidence. And then again, nice simple conclusion, remembering no new ideas, just summarising what you've identified, your priority areas, your recommendations and your management. So thinking about sort of how you might do that. So start this again fairly early in the trimester as you're going through the modules. The case studies, these sort of examples where you've got your case study, think about your presentation of situational factors, risk factors, cultural aspect, the child's age. Remember, these can also may be linked to ethical, which may be parental influence, cultural inappropriateness, also health literacy levels, so that the ethical standards of making sure we've got tailored information, the condition and the related age factors, and the risk with transfer. So think about sort of what are your factors as you're bringing yourself with this case study into then breaking it down. And then sort of looking at these factors related to deterioration. So thinking what are related to deterioration and what was the complexity of the patient. So this one, age, diagnosis, sudden risk of decline, parental understanding, location, and staffing. Legal and ethical factors were staffing, that they didn't meet the best care for and ratios for children, and then the having the inability to actually escalate correctly, and then sort of with the parental understanding, and then the risk of the child's escalation and anxiety. So all factors which were then not correctly sort of followed, which led to the death of this child. So as you're going through, choose a case study that you can really link with your clinical area. Just makes it easier, and then makes the whole course link and establish you as an advanced practice RM, which is the process, what we're wanting to achieve with doing this master's. Thank you.